We appreciate you attending this morning's program, Coping with COVID-19, a Mental Health Perspective. My name is Brian Otten. I'm the Marketing Manager at the Greater Wausau Chamber of Commerce. This program is a part of our Ready, Let's Grow campaign and series of virtual events. We want to, I'd like to introduce you to today's host, Lee Webster. He is the founder and director of the Center for Human Development located here in central Wisconsin. Following Lee's presentation, there will be an opportunity for you to ask questions or to have Lee answer your questions. If you'd like to provide those questions during the program via the chat box to the lower left of your screen, you can do that. I will present those questions to Lee following his presentation. So without further ado, Lee, welcome.
Thank you. It's good to be here. Number of years ago, a best-selling book called The Road Less Traveled was written by Dr. Scott Peck. It was on the New York bestseller list for quite a lengthy period of time. In the introduction, the first words that he put out were, "Life is difficult." Now, he hadn't experienced what we've been going through in the last few months. And it just seems like what I'm doing is I'm constantly facing a moving target. One thing changes to another. When the whole thing started to come down, I happened to be in South Carolina playing golf. And of course, we started getting all kinds of notifications and people were starting to panic. And actually, some of our friends we were a little concerned. Were we able to get home coming back across the Illinois state line? Well, obviously we did. But in the meantime, what happened was we had all kinds of things and issues that we had to deal with out of the office. I run an outpatient mental health clinic, and so we're counseling with people of all ages. And the impact and the amount of fear that was generated was incredible. But it also created some real problems for us as an organization because the state of Wisconsin had not allowed us to use telehealth or any video means to counsel with our clients. Fortunately, I had a couple of students that were working, that I was training, and they had that experience at their university training level. And so we were able to find some platforms and eventually were given permission to use telehealth. Now, in the meantime, we had a closed office except for the support staff, that the couple of them that were here to answer the phones and handle some questions. And I met with them regularly to see how they were doing, and they felt very comfortable being isolated in their little place. As time went on, that isolation got to be a little bit difficult, and I contacted them regularly. We lost a number of clients right off the bat. When the schools closed, we were involved in a number of different school districts, and the kids pretty much just dropped off the face of the earth. A number of our clients were uncomfortable with doing anything other than face-to-face, and so we lost many of them. And yet then there were others that were willing to experiment with telehealth with us. And it was an experiment. We'd never done it before. And so what's happening is we're trying to implement a new platform and have it working properly and running into problems with bandwidth and all kinds of other things. And we started and we navigated that landscape. And so for a period of time, most of our counselors were working from home. And then gradually we started coming back here, following social distancing and other rules and regulations. And of course, it doesn't change. It just keeps going and going. So now, of course, we have these things. People react to these in so many fun different ways. There's one group that is claustrophobic. When they put them in, they don't feel that they can breathe. And so what they do is they either don't use them or they use them in a way that is only probably partially effective. They follow the rule of the law without following the intent. And so they're in various places over their faces, whatever. Then there's another group that is extremely Wisconsin North woodsy, and they're the ones that are sitting there saying, no way, I'm not going to wear those things. And so now they're really upset about the idea that maybe that we're going to be being tattled on to the health department and so on and so forth. So it's a moving target. And it's been a difficult one to go through. Along with that, of course, there's going to be all kinds of stress and mental health concerns that are directly related to the virus itself. And there's no single individual that handles the stress the same way. We all have our own issues and we all have our own reactions. But there are some things that we do know, and hopefully today I will cover them in somewhat of a systematic way to talk about, first of all, what is stress? When does it become distress? And then what are some particular things that may be related to the coronavirus? And then we'll spend some time talking about some options that people have and things that people do to help reduce their stress or develop resilience, and answer some questions, and hopefully we'll have accomplished some things that will help a number of people. Now, stress itself is necessary. The only people out there without stress are either cremated or they're 6 feet under. Stress is a normal response that the human body has when a demand is placed upon it to take any kind of action or do anything. Certainly when the alarm went off this morning and I started thinking about, I've got to get up and I'm going to do this presentation today, my body reacted and got me prepared to do something and to make this presentation. So there's some individual physical changes that take place whenever there's a stressor. That's something that happens on the outside that demands action. And the stress response is the normal response that the body makes to any demand that's placed upon it. Now, in normal circumstances, there's a number of physical changes that may take place. For example, my heart rate may go up a little bit. My blood pressure may increase. Blood vessels will constrict. Because my body wants to act and move, the natural response is the blood that ordinarily would go to my stomach will go to my extremities, so I can fight or flee, or hopefully not freeze up, but that's a possibility too. And there's a certain amount of muscle tension. More blood sugars released, my breathing may become more rapid, and in some cases, if it's high stress, people sometimes hold their breath or breathe very rapidly and hyperventilate. So there's a number of things that happen physiologically that are just a natural body response. Now, ideally, what should happen is our day and our periods of time and stress in our lives should look like waves hitting the beach. And you can imagine how relaxing waves hitting the beach and laying in the sand and hearing the surf coming in one after the other after the other. Well, life should be like that. There should be a stress enough for us to do something, then what happens is there's the lowering and relaxing, then another stress, and another relaxation, and another stress, and another relaxation. And how nice it would be if that happened that way for all of us. Now, unfortunately, it doesn't go that way. And sometimes it feels like we're being hit by a tsunami, and life gets to be, or can potentially be, overwhelming. The kind of stressor it is, the amount of stress, our previous life experience, what we think or believe, all has an impact on that physiological reaction that we have. And it's not just a stimulus response kind of thing oftentimes. It's a stimulus, a thought process that takes place, and then the response. So when I was in South Carolina, a couple of the gentlemen that I was playing golf with started telling themselves really frightening stories about their health. And what if they got that and they panicked and felt that they had to go home early and couldn't stay with the rest of us? So their thinking process literally elevated their stress response almost to a point of severe distress. Distress is that place where there's a line and it's like there's a circuit breaker up there. And if the pressure and the stress response gets so high, what happens is we have an automatic mechanism that shuts us down and may cause health or emotional problems that bring us to the point that we literally have no choice about calming down and settling down. And sometimes those things are very severe in terms and can lead to severe physical or emotional kinds of illness. So the idea about stress is that stress is always here when there's a changing environment. And with COVID-19, obviously, we have had multiple changes that are taking place one after the other. And so because it is a moving target, it's sometimes hard to get that balance. So go back to that nice, comfortable wave action that gives you some chance to relax. And truly, good stress management is nothing more than good living. Now, some of the symptoms that people oftentimes experience during periods of stress are feelings of irritation and anger and frustration. And unfortunately, I think in our culture, some of that's coming out in very, very unhealthy ways right now. There's a lot of people that have been locked up or felt like they've been locked up and imprisoned, and what's happening is that it's very, very easy for them to get upset and lose their temper. That sometimes happens at home in families. That I've heard instances where there have been mask fights. I mean, people are being criticized for wearing masks. They're being criticized for not wearing masks, and creating more and more stress as things go on. And in addition, what will happen is that you may have tense or sore muscles because the tendency is to tighten up. And I can guarantee you, if you want to have a stress response right now, all you have to do is take a deep breath and hold it and tense your muscles, and you will have a stress response. Few people are feeling uncertain, they're nervous, they're anxious, and there's a certain amount of phobia that's out there. The fear of things that in the past they would never have been afraid of. If it continues, oftentimes there's a lack of motivation, a loss of energy. People get tired and feel burned out, And one of the things about depression is that people tend to turn inwards and keep their emotions in and keep themselves closed off. And it's like putting the lid on a pressure cooker sometimes to just hold all that in. When that happens, there's often sleep disturbance and insomnia. Either you can't get to sleep because your mind is racing, or what happens is you wake up in the middle of the night and your brain is racing about something and you have a little difficulty going back to sleep. About 3 o'clock this morning, I thought of a couple of things to add to this presentation. And literally, if I don't make some notes about those kinds of things, I could sit there and just recycle and recycle and recycle things. Gastrointestinal problems, nausea, stomach problems, bowel problems are a very common reaction to distress. And trouble concentrating or being focused. And this is a really difficult one when you're trying to do a job or go about tasks. And in some cases, when you're working with heavy machinery or in a dangerous environment or driving, it could, in fact, cause an accident and be a real problem. And then, of course, there are some people that are thinking about harming themselves. We've seen a little bit of that in the counseling office. Interestingly, there's a lot of teenage kids that are making really foolish statements like, if I can't be with my friends, I'm going to kill myself, things like that. Those are severe symptoms of distress. During the pandemic, of course, there's some there that are very specific to the pandemic itself. Certainly a fear about health, both for yourself and for loved ones, a very, very real concern. One of my grandsons recently had the flu, and what happened was that there were a number of people that were starting to be afraid that, oh my gosh, does he have COVID, and is he infectious, and is it going, because some of us had been together, they were wondering, is there going to be a problem, and is everybody, who's going to get sick? And fortunately, his test came back negative. It was the flu, but the reaction was more dramatic because of the pandemic than it would have been at any other time. There's certainly people who do changes, they have changes in behavior, eating, and they're eating and sleeping. One of the problems here is that we have changed our daily pattern of living, and so we're not following the same sequences that we may have before. And so whenever you make a change like that, it's real easy to change those eating and sleeping habits. And they could go either way. You could either be sleeping too much and withdrawing too much, or not sleeping enough, or eating too much and snacking. And I think someone the other day told me that they had a high school girl told me that she now has the COVID-10. So she'd gained 10 pounds since the schools had closed. I mentioned already focusing and concentrating. If people have chronic health problems, the stress itself oftentimes will increase some symptomatology, and it's really important to stay in contact with your medical professional. Addictive behaviors. Addictive behaviors can include anything that seems to give you pleasure, because the very nature of an addiction is that it seems to work. The problem is that they also have a hangover afterwards. And so what happens is that people will start focusing on alcohol, on smoking, on using drugs, eating, gambling, pornography, exercise. They can get so caught up in that particular behavior that what happens is it has the downside that comes with the hangover, that it has, because it's had a negative influence on their behavior, on their thinking, on their relationships with other people, and it may have impacted their functioning on the job. So a tendency to increase these kinds of behaviors to do what seems to manage the stress, because it always will feel good for a little while, but then it comes back to bite you right where you don't want to be bitten. Irritability and anger, and I've commented about that already. The shortness, the difficulty, the anger, the tension, and that comes out in oftentimes in very unhealthy ways. We're seeing it with couples and families at this point in the counseling office. And if it's aggravated with drugs or alcohol, that makes it even more volatile. I read a study not that long ago that indicated that in England, the number of claims for divorce have significantly increased since the pandemic. And interestingly, yesterday I saw an article that said just the opposite, that said that marital couples who are functioning well handle the pandemic better because they're one another's best friends, and they aren't socially isolating from other people, and they are kind of pulling together. And so for some couples, it's really resulted in more time together to do things. My wife and I have had a habit of reading novels to one another that started a number of years ago. That's one of our stress releasers. And we'll sometimes just turn off the TV and read a good novel. Unfortunately, right now we're reading some that are pretty light and fun. There are a number of work-related issues that do come up, and we've had to face them here. And I'm sure that almost every employer and employee has had some of these things. A worry about exposure. I mean, of course, there are a certain number of people that are really very, very anxious about being exposed to the virus, and in some instances they are so anxious that they are quitting work or not wanting to go to work, or developing and calling in sick, doing things like that, and that's out of a fear that they have that something is going to happen to them. There's anxiety about caring for the needs of one's family. And when we think about it, how tragic it is that there are situations where the number of hours has been cut back, or people have been released from their jobs, or whole businesses have had to close down for periods of time, creating economic difficulty, something we haven't experienced as a culture in the past. In the past, when there's been major health issues, what we've done is we've quarantined the sick people, but we've kept things going. And in this instance, there's been major impacts financially. And they've had a major impact on families. And in the state of Wisconsin, of course, the problem with collecting the unemployment has caused indeed additional distress for people. So there's a certain amount of uncertainty about the future and what is going to happen. And one of the things that the Chamber is trying to do, and that we're hoping to do as a culture, is to see if we can weather this storm and keep businesses healthy and alive and working and keeping people going. On the business side, you've had to learn new communication tools and technology. When all of a sudden people are working from home, It's a whole different kind of situation. And in our case, we had to learn to counsel with people over telehealth networks. And frankly, it works for some people and it works well for some people, but it doesn't equal the face-to-face contact that you have, because counseling and mental health is really meant to be a relational person-person relationship to help people deal with things. The other thing is that people have modified and adapted to their schedules in very different ways. And just the adjustment and making those changes has in and of itself been for some people quite distressful. So, what's good stress management? Good stress management is really a matter of good living. It's a matter of developing resilient skills that keep us functioning. And I tend to want to look at people as multidimensional. There are some physical things that they can do to take care of themselves. There are social and relational things. There are intellectual things that you can do to enhance and take care of your distress. And there's certainly psychological or emotional responses. And then there's a spiritual dimension. And they're all connected. If there's distress at one level, it's going to cause and force adjustments in each of the other areas. But there's other areas that you could put more emphasis on to pick up some of the slack to actually enhance your personal and corporate resilience. So I'm going to go over a few of these that I've had people talk about and that we've dealt with in seminars that I've done on stress management, and be aware that some of them crisscross with one another, and some of them may not work for you, but they may work for someone else that you're in a close relationship, whether it be a family member or an employee or another colleague. So let's talk about physical self-care. A number of years ago, longer than I want to remember, really, my son went out for cross country. He was a freshman at East High School in Wausau, and Bill Smiley was his coach. And everybody loved Bill Smiley, but Bill Smiley was also a good coach, and he was a bit of a driver. So I would pick Tim up after practice, and he'd be like a limp rag. He was worn out. And I'd say to him, Tim, how far did you run today? And he'd talk about some impossible distance that they did on a daily basis for training. And I'd said to him, Tim, you must really love to run, to do that. And he looked at me and he says, no, Dad, I hate it. I hate it. But when I get done, I feel better than I've felt all day long. One of the most remarkable cures that I ever had with a client had really very little to do with me. He was a business executive who had a very aggressive exercise program. He would get up at 5 a.m. He would push himself really hard, shower, clean up, go to a very stressful job, come home, have 3 martinis, and have a fight with his family over dinner. And one thing that we changed was this. He got up in the morning. He went to work early. He came home from work. He did his aggressive workout in the evening when he got home, and told his wife about it, and the family just let him do it. He'd come back, showered, relaxed, didn't have the martinis, and the family just stabilized and settled down. Exercise is probably the single most important thing that I can recommend to my clients if they're feeling high levels of stress, and it just simply works. Why does it work? It works because what happens is your body is getting under stress, is getting ready to move and be active, to move those big muscles and to get things going. And when it does, it burns off all that energy that's built up to act, to fight or run, and starts moving that energy. And as subsequently, the whole body ultimately relaxes. It's horribly hard to get started, isn't it? But once you get started, it's a big help. And in all honesty, my wife is the best coach that I've got. When I'm reluctant and not wanting to, she's the one who says, honey, we got to put the exercise tapes on. And so what we'll do is we have a routine, and I need to give her credit because she's the one who's helping. And it's really good to have a partner that's encouraging you to exercise. Develop regular sleep patterns and get enough sleep. Now, this should go without saying, because when you're tired and you don't have energy, it's really hard to function, right? Eat regular healthy meals. Now, there's a real tendency when you're feeling distressed to reach for the M&Ms. That's my trap. Or to snack. And especially now that you may be staying at home and working from home, and all that food and things are available. Excuse me. It's real easy to get caught up with that. It's very helpful to spend time outside, breathing and getting fresh air and appreciating the things that are in nature. So if you combine your exercise with being outside, so much the better. Those of us who live in Wisconsin realize that for the most part, you don't have to stop doing things in the winter. We have a relatively new employee who came from a different state and said, I can't believe it. People in Wisconsin stay active all year long. Social relationships. Social relationships are key. And that's one of the biggest problems that we're facing and have faced with the stay-at-home rules and orders and things that say don't go out and don't be around your friends. For some people, hugs are very important, and that's kind of their love language. And if they can't be around somebody and have contact with them, it's very frustrating. There's a lot of help that takes place when people can connect with other people and talk about things and share things and be connected with other people. And during this period of time, we have to be creative about how we can do that. Yes, there's a certain amount that you can do online. There are certainly connections that you can and need to make. And I'm thankful that I have a couple of good buddies that sometimes I can just run issues past them, and we can talk about things that are going on with our families and with our business and other activities. It's really important, though, if to move beyond just that superficial sometimes, and to ask for the support and encouragement and be able to talk about the emotions. And we'll talk more about that in a minute. Be tolerant. It's really important during this time to be tolerant of other people, recognizing that their fears, even if you think they're not founded, are very, very, very real. I don't want to be a distressor for other people. Now, I recognize that sometimes we may have very different opinions and views about things, but if what's happening is that the conversation seems to be indicating that it's a distressing thing, then let's just drop it and not make an issue of it. In relationships, it's really interesting that every couple and a lot of close relationships have developed a pattern that sometimes when it gets started, it's pretty predictable that there's not going to be a solution to it, that all you're going to do is go through a fight pattern and get to a common bad feeling that you've had dozens and dozens of times. Now, there's a very real reason for that. The good Lord created the human brain in such a way that when you're feeling distress and have the sense that you might be being attacked, you go into this fight-flight mode. When that happens, your brain literally shuts down part of your brain that does thinking and rational problem solving. So I've really encouraged people to do things like take a time out, go to a neutral corner, take a deep breath. And chances are when you do that, when you call time in, you come back and the issue isn't even important anymore. And finally, be involved and support others and reduce the focus on your own anxiety and help to focus on others. Intellectually, I have imagined what it would be like to be a 5-year-old listening to CNN. And all the doom and gloom that's reported in the news. We know the rates are going up and how many people have died and how many people have been hospitalized and what terrible this pandemic is, and on and on and on. For a child, and for the child in each one of us, too much of that stuff can be very, very anxiety producing. It's terrible to have a child come and say something like, I'm afraid that if I go back to school, that what'll happen is I'll come home and my mom or dad will get sick or die. Now we're dealing about their fear of abandonment. And I can remember as a child when and this will date me, when the polio crisis was on, that people were very, very afraid. And we as kids were very anxious. And thank goodness we had reassuring parents, some of us, and obviously we got through it. And we will get through this too. But the time and the things that you focus on are going to have a big impact on your overall emotional response. Focus on the facts and understand that the real areas where there may be risk for yourself, your employees, or your loved ones, and take what you consider to be reasonable precautions. And understand that they may see it differently, but just be sensitive to that whole piece. And be aware that on the other side of every one of those negative reports, there's a positive report. There's that piece, if you take and you divide the number of people in a given area into the number of incidents, you'll find that the numbers come out to be 1 in 1,000 or very low. So the news isn't particularly wanting to sell you on the things that are happening that are positive, but try to keep your focus on those things. Be sure that you structure your time and your priorities. Time structure can lead either to anxiety or to depression. If your time is overstructured, oftentimes you'll end up feeling more anxious. If it's understructured and you have a lot of time to think, potentially it'll go the other way. So structure your time. If you have a hobby, you do it. If you can, enjoy those things that you like in the non-work hours. And don't set goals that are too unattainable. And finally, be aware that there are some things that you cannot control, that they are totally out of your area of control. You can control what you do what I do to take care of yourself. I can control what I do to take care of myself, but I can't make anybody else do things that they're not willing to do. I have some control over the environment that I'm in. And that I really appreciate. But I don't have total control. And right now, there's certainly during this time, there are some efforts to say that others are taking control over my environment, my work environment. So if I'm ordered to wear a mask and other people are ordered to wear a mask, that's not something that's within my control. But I can control whether or how I react to that and what I do. Emotional self-care. Focus on the positive. Excuse me. And the positive is where we build resilience and hope and options for the future. Learn and use relaxation skills. One of the most effective relaxation skills is one that women are taught in Lamaze training during childbirth. It's a wonderful relaxation skill. It teaches people to focus and literally bring down the pressure and tension in their bodies. Unfortunately, oftentimes we don't tell those same women that when their kids are screaming and out of hand and whatever, that sometimes the same breathing and relaxation techniques are very effective. Relaxation skills are very good, but they need to be practiced so that when you're in a crisis or a deep situation, you can remember to take that deep breath and focus. Breathe deeply. Oftentimes when people are tense, what they do is they tense up and they stop breathing. Like I said, that increases the tension. So learn to take that deep breath or a series of deep breaths and breathe deeply. If you're on medication, definitely don't quit it, because if you do, without medical advice, you could cause more stress. Talk about your emotions. Talk things through. Let people know when you're feeling anxious or scared or significantly depressed. And if you need help, ask for it, and please seek someone that can help. It can be a friend, could be a pastor, a mentor of some kind, and if necessary, seek out help from your physician or from a mental health professional. Spiritual self-care. One of the concerns that I had were a number of the churches were closed down, and yet for many people, that was the place that they would go to connect and find a sense of peace and promise and relaxation. You don't have to let distancing keep you from regular faith experiences. You can certainly find some online. And many churches are now open and has practicing social distancing. Meditate on the things that you're thankful for. And another one is to take care of others and reach out to others. There are people who are desperately lonely, people who need physical help in a time like this, it's always good. If you're focusing on other people, you're not going to have quite so much stress focusing on yourself. Now, what about in the business setting? Obviously, there's some people that are online here that are dealing with issues that have to do with the work environment. First of all, the most important thing to start with is to take care of yourself and be a good example. Your self-care is essential. If, as an employer, what's happening, or a manager, is what's happening is you burn out and you fall down, what's going to happen is it's going to have a downward impact on everybody else in your environment. So take care of yourself. Be a good model. Encourage your employees to maintain a regular schedule. And this is especially true for those people who are now working at home or working online and aren't having the contacts that they had before. It's really easy to get caught up in a project and not want to take a break. One of the recommendations that I've used for years when I've talked in corporate settings is to tell people, look, you have break times scheduled into your regular day at work. For heaven's sakes, take them. And I know I've frustrated some employers because I've also told employees that when you're in your break and your boss comes up and say, oh, I've been meaning to catch you, it's really all right to say very nicely, and hopefully your boss will understand, oh, I'm on my break right now. Can I catch you? When can I catch you later? Or would you catch me later? Because those breaks are part of that wave hitting the beach. So as the stressors build up, you want to hit relaxation time. There's a number of corporations that have literally incorporated stretching times in the course of the employee's day, where they take very short, brief stretch breaks. If they've been sitting for long periods of time, they'll have them stand and then reach as high as they can for the apple that's just out of reach, and then reach a little higher and stand on their toes, and then do it with the other arm and roll your neck around and do various kinds of exercises. And what they find is that when they do that, people actually perform better. Communicate. Communication is a two-way street. It's really important for you to be very clear in setting the goals and directions and structures and expectations as you're going through this process and as things are changing. You need to be sure that you keep people on board and they know that you're taking the leadership that is necessary, but that you're also paying attention and concerned about them. So when we first closed down and we're doing all of our telehealth things, all of a sudden what happened was we had a couple of employees that were in individual offices answering the phone or doing some paperwork, but everybody else, all the counselors and everybody else, abandoned the building and they were sitting there alone. Before we even made the decision about their coming back and doing that, I talked with each of them and made sure where they were, listened to their concerns, and wanted to know exactly where they were and if they were really open to coming into the office and doing and working in those private settings. They were, fortunately. And then I made a point to be in contact with them on a very regular basis to make sure that we knew where things were. And that's part of just taking time to talk and be supportive in maintaining relationships, because ultimately relationships are everything. And then it's important for you to know and utilize what resources you have, either for yourself or for your employees. For example, your EAP is a really good ally. If you have one, if you recognize that you need something, or if there's other people that are working around you, encourage them to contact that EAP and set up an appointment and talk with them. There are hundreds of resources available in the central Wisconsin area. And if you call United Way 211, they can direct you to everything from counseling to disability to exercise programs. They're wonderful. And it's important to be able to take advantage of those things. Take advantage of things like your YMCA and other programs that are available within your community that are social distancing but still open and setting up programs. Now, just for a moment, I did add the reference to the National Suicide Prevention Hotline. Sometimes when people are extremely stressed, what happens is they develop a high level of depression to the point that they're thinking about self-harm or perhaps even harming others. But if that happens, it's really, really important that they seek out and get help. It's very easy to want to ignore talking about that. But frankly, sometimes the best thing is to ask is, are you thinking about harming yourself? And if the person is, then it's important to help them get to the place that they can get the kind of help that they need. So there's a time when it's important to just stay with them and help them get to the kind of intervention that would be helpful for them to survive. Interestingly, the reality is that this too will pass. And what will happen is that suicide is a permanent solution to a temporary problem. The National Alliance for Mental Illness, I put them in here because in my research, I found what they did was they have a number of resources, including wonderful posters and things that you can use in the workplace, and they are an excellent resource. So there are a number of options and a number of places where you can go to get information. National Center for Disease Control is there, and as another link, you might want to seek them out. But there's a number of resources that are available, including a number of really good mental health clinics and services in the area. North Central is certainly a resource for an emergency or mental health care, and as well as many of the private agencies. And if it's a real emergency, then seriously consider the hospital. The most important thing to remember is that we're going to get through this. We will survive this. Our nation has gone through crisis after crisis after crisis. And individually, each of us has had crises in our lives. And sooner than we move through them, for heaven's sakes, our house burned down in 2000, total loss. And at the time, we were devastated. And with the help of friends and just all kinds of things that came together, we got through it. And we are going to get through this, and we're going to get through it together. And just remember, the future is there for us to create, and the new normal could be better than the old normal, or it could be worse. And you have a lot of influence on that, and I do too. So it's important to hang on to the hope for the future. I've really appreciated this, and I guess, Brian, it's your turn, and I'm going to turn it back to you now.
All right. Well, thanks, Lee. That was a fabulous presentation. I invite anyone who has questions to enter them into the chat box at the lower left of your screen. I will give those questions to Lee. While we're waiting for some questions to come in potentially here, Lee, I have a question for you. Now we've been back in the office here at the Chamber for a number of weeks, but for almost 2 months, we worked from home. And when we were doing all the virtual programs or sort of virtual meetings and seeing each other pretty much exclusively through Zoom, is there a way to, or I guess, what have you found, or do you have a method that as a coworker, you can sort of best connect with those other coworkers through this virtual setting and be empathic towards them, and maybe even identify instances where they might need some help, and how to give that help, given that we're separated by technology.
Okay. There's a temptation, I think, with technology to keep things on a very intellectual, heady level, and it's certainly the large group situations, I think, may present some difficulty with that. But certainly, if you can Zoom one-on-one with someone, or have a conference and talk one-on-one with someone, I think it's really important to just simply sometimes just pay attention, because you can see them on Zoom. If you notice that there's any changes, they seem tense. But I think it's really important to say, hey, how are you doing? Or if there's something that's really been stressful for you, I think it's important to talk about those things, because there's more of a tendency to do that when you're face to face. But when you're on a meeting like this, it's likely not to happen.
Okay, that makes a lot of sense, Lee. We do have a question. Are you seeing an increase in clients with anxiety that had been previously controlled that now is out of control?
Yes, that's and it depends. Obviously an individual thing, but yes, there are some clients that previously had been able to manage things and had things under control, but now it's increased, and particularly there's been a lot of anxiety around financial issues, and family stress is really increasing tremendously, and people are anxious about their relationships. I think as we open up more, we're going to find more and more that certainly if the schools go back and they start picking up and dealing with the kids, that I think we're going to see even more.
Okay. The last question that I have for you, Lee, is, and you made a great point, I thought, in encouraging people to sort of limit the amount of media that they consume. I'm a former member of the local media, and so that's hard for me to acknowledge or encourage people to do. But even in my own household, there are individuals who would escape to, for example, social media. That's not really a place that's devoid of conflicting headlines and conflicting information. And I guess what sort of distinction do you make between social media and the general sort of mainstream media, or is there no distinction at this point?
Oh, I think there is. I think the mainstream media picks up a story and presents it, and they're looking for whatever it is that's going to be a selling for their station or whatever. The social media can take any kind of information, and it could be distorted, it could be exaggerated, it can be extremely emotional, and in some instances, it can be extremely seductive. So people that sometimes will, for example, we've had people that have met someone in a chat room from miles away, hundreds of miles away, and developed what they thought was a very intimate, emotional relationship. And it doesn't work that way. And so I have some real cautions about the extent of stuff that can be happening on social media. Besides that, I think we have some pretty clear indicators that the amount of time you spend on looking at the screen may not be healthy for you. So I think there is a distinction, clearly.
Okay. All right. Well, Lee, we are almost to 11 a.m. I want to thank everyone for participating in this program, especially thank Lee for hosting the program. I do want to point out that we were having some technical issues in the first 10 minutes or so of the program. And for not only for that reason, but with all these programs, they are recorded and they will be available on the Chamber's YouTube channel, likely as early as this afternoon. So you can visit the Chamber's Facebook page or other social media channels to get that link, or visit YouTube and look at find the Wausau Chambers channel, and you'll find a recording of this presentation. I also want to encourage everyone to keep an eye out for our Business Week events, which are coming up in 2 weeks. We have a variety of virtual events aimed at celebrating our local business community, including our Small Business of the Year Awards, which are typically held in April, but this year have been pushed back into this month. And so I encourage you to attend those events. They're all free, and there's going to be a lot of fun, a lot of networking opportunities, a lot of opportunities to recognize local businesses. So, Lee, thank you again for your time.
Thanks for having me.
You bet. And thanks everyone for attending, and that'll complete today's program.